For my Theory of Learning practicum lesson plan, I went with Introduction to Radiology, and here are my two students that will be demonstrating the lesson plan to today. I'll be demonstrating my teaching methods in both explaining the lesson plan and in a guided exploration in my Chapter 1 for Introduction to Radiology. So for the Introduction to Radiology, it's a didactic course, and that's what we're going to be going over today. Just kind of setting up the profile, which is a really important step to do when creating a lesson plan. You need to teach to the group that you are trying to get across to. So in this particular class, we're working with 20 students, median age of 24. They're able and eager to learn. This is their first chapter in Introduction to Radiology. Most have their college experience in, but all are high school graduates. We're able to work in groups in this class, which is really beneficial, and we'll see that here in our guided exploration after our lecture. Prior knowledge with these students, they do not have hands-on radiology experience quite yet, but they are acquainted with the basics from other classes. So in this lesson plan course, we'll be summarizing and note-taking and using hands-on connections for learning preferences. And I will give you guys a paper copy so you can follow through. So going forward in our class, we are going to put up a schedule and go over the goals and objectives and expectations of that class and the day. So this lesson specifically for the Introduction to Radiology Chapter 1 helps the students explore the necessities of dental radiographs, and it will introduce hands-on learning, which will help them connect information in preparation for their lab coursework. They'll have access to a PowerPoint lecture, which I will just briefly kind of go through here today, and they'll have the opportunity to practice identifying various aspects of radiology through guided exploration. So we've got one with the skull, and working with sort of PID and horizontal vertical angulations, and also with mounting for films, which will prepare them for lab. They'll be able to identify normal and abnormal anatomy and conditions, and the importance of high quality radiographs will be emphasized. So we have both course and class objectives. These are kind of the expectations that we have for our cohort in class in regards to this lesson. In regards to course, we want to analyze oral pathology and anatomy radiographically, evaluate and understand the basic setup and placement of films in the PID head, evaluate and apply why radiographs are necessary and when certain radiographs are necessary, and identify technical and processing errors and explain the cause of errors. Now in this class today, my goals and expectations for you are to summarize guidelines for prescribing the number, type, and frequency of dental radiographs, explain who benefits from the radiographs, and give examples of common dental anomalies, diseases, lesions, and conditions, and all of these that the dental professional may expect to find on their x-rays. We'll be analyzing and summarizing the importance of radiographic interpretation. And so following along on our sheet here, feel free to take notes and ask any questions throughout. We're going to be informing students of the goals and objectives of today's course. We kind of just did that. We want to make sure that the explanation of the day's expectations are very clear, and that's from both the instructor and the student standpoint. So to do that, we're going to include an agenda, instructions for the guided exploration segment, any questions that may have arose since the last class. We don't want to leave students hanging and then they're not able to connect the new information if the base isn't built up and strong. There will be a 5-question quiz to assess learning at the end of class. Alrighty. So for the PowerPoint, it's highly recommended to take notes during. A lot of different students have different ways to learn. Some learn audibly and visually. Some need to be hands-on and be writing and seeing what they are taking in. So there are a lot of different variations that our students can absorb this information. They're also highly advised to use their resources like our lab and textbook. And I do advise students to use this, as a lot of the quiz questions for our summative assessments are going to be in the back of each chapter. A lot of the information is summarized and key points are taken away from this book. So 30 minutes will be put aside for the PowerPoint. We're just going to briefly go through that. As I mentioned before, the demonstration of my teaching will be in regards to the hands-on guided exploration. In the PowerPoint, we've got topics of who benefits from dental radiographs, how are radiographs used, and what can be found on a radiograph, and why patient education. All of these points tie into our course and class objectives. So we're kind of keeping it big picture here and all organized. We're going to touch on interpretation versus diagnosis, interpretation, the dental hygienist, use of radiographs and preparations for lab. This is going to prepare them for their formative and summative assessment that we have throughout class and towards the end respectively. Okay. So, guided exploration, why are we doing this? Like I mentioned before, students all learn in a different way. To keep the students interested, we are sitting in a 1.5 hour class and they do have a busy schedule. They're here in school, they're cooped up all day. This actually lands in the summer semester where there's nice weather. We have to keep our students intrigued. We want to extend further learning preferences and instigate critical thinking and provide big picture comprehension. The curriculum included a hands-on activity as well. When we were looking at different evaluations from students in the cohort prior to this class, a lot of them had feedback of wanting bigger picture comprehension, which means we want to relate this information to the real world. Why do they need to learn it? Why is it something that's primitive for us? It's hard to kind of connect that when they're just beginning the program. Okay, so after the PowerPoint, like your handout has said, following the schedule, we'll be doing our guided exploration. So the expectations for guided exploration today, I brought a skull to class. We're doing the demonstration with 2 students, however the library has about 8 skulls. So with the 24 people, we can break into groups of 3. We can take a vote in class too to see if they would prefer to split half and half within the mounting and the skull. But if you don't have an assistant and it is just you teaching, with one instructor, I think it'd be most beneficial to just stick with one guided exploration at a time. So starting with the PID and skull exploration here. I'll move that so you can see it. So skulls or typodonts are brought to class and they're from the library to utilize. You can also share with the students that they can check out the library. A lot of times it gets forgotten and it's a really great tool that students can use as a resource. And then also have a small cup, and this will represent the PID tube head. Let's see. And there is also a small sticky note, and this can represent either the digital or PSP sensor. So we can kind of get an idea of how we need to line up the PID and the sensor within somebody's mouth. And then this can kind of give students an idea of horizontal and vertical angulation, since they're just kind of words before you're doing it hands-on. So I will be giving you the type of radiograph, if it's a bite wing or a periapical, and I'm going to be asking you why it's important that we do this specific one. For example, what do we find, or why do we take bite wings? What's the main thing we're looking for that we can see in a bite wing? And the answer would be bone level, right? Or interproximal cavity. Yes, exactly. Okay. And while I'm walking around and giving each student their own time and individual lesson, then they can keep practicing angulation during that time. The discussion in regards to the PID exploration is to discuss angulation, both vertical and horizontal, film placement, anatomy challenges, tricks, and tips. So I will be having Megan show me how she would place a bite wing. And you can pick either an anterior or posterior bite wing and line up your tube head like you would. It's not sticky. Awesome. So tell me what you are doing here.
I am putting the sensor in the posterior to get the molar shot, and then putting it a little back so I can get the retromolar pad as well.
You can pretend. I saw how you placed it.
And then I would come about here to take the bite wing.
When we're doing bite wings, we sometimes do have to adjust the angulation, but what should we start at to kind of see? Horizontal, perfect. We can be 0 and plus or minus 10 depending on our patient's anatomy. Anatomy is going to be different for everyone. We can only practice on a perfect bite and perfect occlusion on a skull sometimes, but we'll definitely have to get experience. When we're lining this up, are we trying to go through the contact points? Yeah, so like we had.
So you can see in between your teeth.
Exactly. And if it helps some of the students, they can use their pencil and find the interproximal contact point and kind of line the tube head up parallel or perpendicular to it to make sure that they're getting the open contacts and visualizing that. That's the biggest takeaway from this is visualization. In regards to the mounting, so going back to our book, film mounting, there's a whole section that we can read about this, okay? So I want to make sure that you guys really understand this. I know we don't really mount anymore by taking the PSP and developing films, but a lot of offices have digital, but it's still important to understand the layout and what we're trying to get in each image. So refer back to page 9 in your interpretation book. In the FMX radiograph, there will be 18 separate images. Each student will have the same FMX so we can create an easy consequential discussion in our closing statement. Images will be mixed up and students will get to mount on their desk. This is in preparation of their mounting SA in lab 2 where they will be timed, but this is more of a casual environment where they can get their hands dirty with this. In discussion with this guided exploration will be anatomy, curve of speed, matching restorations, maxillary sinus, etc., and ideal placement. So Olivia, I'm going to have you kind of put together here this FMX. You don't have to do the whole thing if you just kind of want to.
Let's see here. Alright, so this is a bite wing, I think.
So what do you see in some of these images?
Looks like there's some porcelain fused to metal crowns.
Sure, and what are these really white
I think a
fillings on
mouth
top?
dump.
Yes, absolutely. Do you know here too how to make sure you have the right and left side correct? A good trick is to look at the roots and see how they're curving. They're going to be curving distally. And
Okay.
also remember our curve of speed, that smile when we're looking for the bite wings. And a tip I have for you is to start with the bite wings and you can match up restorations accordingly.
Okay,
It's like a little puzzle.
perfect.
Great. Good, those look like they match. And so do those.
Okay, let's see. So this would go up here, I think.
And remember from our reading, how many do we have in the center for the anterior?
3.
Yes. And those are easy to kind of pull out from the rest to get organized during your mounting as well.
Okay.
So as she's doing that, teacher would walk around, help, things like that. We are getting short on time here, so we'll just hop to this disclosing and discussion. The final objective is to summarize and connect the newly retained information. What did the students find out and learn? This is a great opportunity to have an in-class discussion and get more people involved and stay interested. And then at the end, we'll be assigning end of chapter questions for extending today's topic. That can be more of a formative assessment that they can take for homework and to tell the class that this assessment is going to be really beneficial with takeaway points and the quiz, which I've also printed out, and moving for the next class at the beginning is when they would be taking this quiz. This kind of helps them understand that the homework that we have really helps to benefit them, and it's not just something you learn and dump out of your brain. It's something that we're working on, and hence for the questions beforehand in each lecture. Alrighty. So learning assessment, like I mentioned, the 5-question quiz, that is summative learning, and the formative homework, and that is what I've got. Thank you for coming in and listening today.
Yes.